nursing has so many aspects to it, and as a sister or as a nurse, you can work almost anywhere, do anything you actually want to do pertaining to caring for patients. So today we will be looking at theatre sisters. We'll be discovering, what does a theatre sister do? What are the roles and responsibilities? Where can she work? Obviously in the theatre, but really where? And just how do you become a theatre sister? So this is a Dr. Tebz show where we're putting your health back into your hands. Today, we are having Sister Lydia Valentine. She is a perioperative nurse specialist, and she works at the Red Cross Children's Hospital. So she's going to be shedding light about, this whole thing about being a theatre sister. So thank you so much, Sister Lydia Valentine, for being on the episode with me today.
Thanks for having me.
So tell me, what is a theatre sister?
Well, I think a lot. I actually get asked this question quite often.
Yeah.
Because when I say we scrub, people are like, but what does that mean?
No, what is to scrub in? But we get there. What is a theatre sister then?
So essentially, a theatre nurse is, we essentially are nurses.
Yeah.
Who specializes in scrubbing, or essentially preparing for patients. So our role, like you said, I'm a perioperative nurse. So we see them beforehand. We ensure that they are no PRs.
No PRs means? As in they're not eaten, they're starved for 6 hours or so, yeah?
And wait, since you're on that topic, let me just say this. Sometimes we need to ensure that they haven't eaten.
Yes.
Then the parent will be like, but they had a chip.
That is
I usually tell them, if you have the chip, have the entire packet. Because we need to ensure that your abdomen is completely empty. So you cannot have anything. If you have something clear, it's okay. Like an apple juice or water, then it's fine. So these are the things we look at. We also look at their diagnosis, their medical history, their previous surgical histories. That is important to us so that we know what we're going to find. If we look at previous surgical history, you will know you'll find adhesions when we do go into surgery. Automatically then takes longer, so you're also able to prepare adequately in terms of looking at the history, where they're coming from, what the situation is. So that is an aspect that we look at. So we look at them pre-operatively, and then intraoperatively our function is essentially we advocate for them while they are asleep, because obviously we work with kids, so we really either have that they awake. Yes. Like in adults, you'll find they will be awake, they're just probably sedated or something. We tend to avoid that. We do sometimes do conscious sedation depending on the procedure. But when
you say conscious sedation, you mean you don't put them completely to sleep. You give them medication just to make them a bit drowsy, but they're still awake.
Yes, essentially. So but with kids, obviously, we'll put them a bit more to sleep compared to an adult. But essentially our role is to advocate for them and to ensure that nothing goes wrong with them, because they cannot speak for themselves, they cannot speak up for themselves, they cannot say anything because they are pretty much asleep. And obviously they are kids, so irrespective of the fact that they are asleep or not, they probably cannot speak for themselves. So we do then speak on their behalf. That is our role. We obviously prepare for the team. They have discussions with not just my nurses, but the doctors that I work with as well, to prepare adequately for the procedure. And then post-operatively, which is after theatre, we initially first say to them in recovery. We then have a discussion as well in terms of how we would look after them post-operatively when they go back to the ward. What are the orders in place that you need to do, whether it's you need to monitor them for a specific period of time. So in recovery, we see to the basic needs, that essentially just waking them up and ensuring that they recover well from the anesthesia, which is the beds that put them to sleep. So a theatre nurse then during as well, we ensure that so there's a lot of things that is inclusive while you are in theatre. So you need to ensure that there's sterility, which means everything is sterile. There shouldn't be a tear or a break or a damaged packet or anything. So you need to make sure everything is sterile for your patient.
Yeah.
And you must maintain principles. You must ensure that the environment is clean. So we cover cleaning, terminal cleaning. We assist with the cleaning as well. It's not just we call the cleaners to come clean. We actually assist with cleaning in between as well. So we do in the morning, we do like thorough cleaning, damp testing and all of that.
Yeah.
Then in between patients we clean again, and then at the end of the day essentially we should terminal clean again, where we push out things and have a deep clean, and we're mopping and all of that. And damp testing, eye dusting, like low dusting, we literally do. We assist with all of that. So it's not necessarily so much more things that we actually need to do. And a lot of people don't realize. So sometimes we will say, okay, it's going to take some time, because sometimes we have like infectious patients in between and you need to literally stop, because then we delay the list. So these things that we have to discuss. So as a nurse, it is your role to discuss with the anaesthetist and the other teams to say there will be a delay due to this reason, that reason, and that reason. Like say there's potentially a patient that comes in with contact precautions, and you discuss that with the team.
Yeah.
What we can do is to continue the list. We start the patient in another theatre, but that's essentially all of what we have to do. Then do management as well within theatre. We do teaching. That is another aspect. And there is just so much more things that we do actually cover as a nurse, but in a nutshell, essentially, we are there to, we scrub, we make sure that there's instruments, and then the instruments are actually there, and is prepared for the patient to get their surgery, as well with consumables. Sometimes there are where patients get cancelled because of a lack of consumables, which is unfortunate, but essentially that is our job as a theatre nurse.
Yeah, Lydia. I knew you worked, but I didn't know you worked that much. How? So when I leave theatre, you're busy there, my friend.
We are so busy.
My word. Okay. Let me behave. So tell me. So how does a person qualify as a theatre sister?
Okay, so essentially, to become a theatre nurse, you basically just need your nursing degree qualification or your nursing diploma, depending on what you did in the past. At the moment, I think they are steering towards nursing degrees and not diplomas.
Okay.
But this is the undergrad that I'm speaking about. So you just need that. You can some of them we actually do community. Some of our staff members are community service nurses within the theatre. So as soon they're fresh out of university and then they start with us, we teach them, we train them, we guide them, we supervise them. Then essentially that is, you just need to find the opportunity or a place where it is available for you. Often, like you don't get to choose, like you will say, okay, I would love to work there, but you don't always get in there. But they obviously, as time goes by, you can apply for a specific post where there is a vacant post and say, I would love to apply for this specific theatre post with you. Like as a student, you get exposed to the various disciplines and areas. So then if you find that you love theatre, then you can obviously ask them, can I be rotated to theatre instead of working in the wards or in ICU? So that is one of the options. However, when you are in theatre, you can obviously specialize. Because it is a specialist area. So we teach you the basics when you are in a general professional nurse post. At Recra specifically, we scrub for everything. Okay. As a general scrub person, at other hospitals you'll find that they either just scrub for orthopedics or like they fix broken bones, or you find some of them fixing hearts, or it is just like that at other hospitals. At our hospital specifically, we cover everything.
So you go from one theatre where they could be fixing bones, and the next thing you're in the other theatre where they're fixing a brain, in the another theatre they're doing the eyes.
So essentially,
so you change, like variety.
We are taught to be able to be versatile. And then when you specialize, you need 2 years experience. It can include your community service year and your 1 year as a professional nurse. That's the requirements from the South African Nursing Council to specialize. However, in government, they require you to have 4 years experience before you can actually apply for study leave for the specialist post unless you resign and do it by yourself.
Okay.
So then the only time you actually get like an increment in your salary is once you, well, with the government is once you actually specialize.
What
so
you mean is becoming this perioperative nursing specialist.
That's what I did. So I did the course last year.
Yeah.
So it's a year-long course. It's a postgraduate diploma in like perioperative nurse specialist. It's offered at the moment, Stellenbosch is the only university accredited in Cape Town.
Yeah.
The Western Cape College of Nursing is still applying for accreditation.
Okay.
So they're still in the process, but they are getting there, I think.
Okay. Phew. All right. So, I mean, now that you're a perioperative nurse specialist, I mean, how high can you go? Because some people are ambitious out here and they want to go. I mean, so, like, how do you develop in your career? From here, where can you go?
So from here, I can either become... So because I'm now considered one of the seniors,
yes,
I don't feel like a senior.
No, but you are a senior. Don't worry, you are very senior. I've seen you. Mm-hmm.
So essentially, I've reached my capacity unless I want to become an operational manager, which at the moment I do not want to be. I think I'm okay where I'm at. I would still love to gain a lot more experience. Or you can essentially become a lecturer.
Okay.
However, to lecture you do need your masters, which I do not have at the moment.
And you are going to get, yes.
Most likely. So then you can lecture. Then you can lecture the schools specifically, or you can lecture other nursing categories as well.
Okay.
If you do want to progress in terms of in nursing itself, then obviously you can become an operational manager or area manager, which still falls under theatre.
Yes.
And then from an area manager, you can go to like a deputy manager or the nursing manager of the hospital. However, those are not in theatre.
Those are outside of theatre.
That's outside. It's like your matrons, people.
You're overseeing.
Yeah, the overseers.
Yeah.
They, however, don't do much clinical work. They do a lot of admin. So obviously it depends on you. Me, I prefer doing clinical work. So I will probably be in theatre for a while.
So what are the pros and cons of being a theatre sister in your experience?
The pros, it is very rewarding. We really get to help. In every patient that comes through our doors. And I'm saying coming through our doors, we can help them. A lot of the times we get patients with diagnoses, like for instance, certain brain tumors that are inoperable, which means they cannot operate on it. We won't ever see that child unless there's something that we do for them that helps them in palliative care or like in the phase of them passing on essentially, we just make them comfortable. So there's certain surgeries that we would do to help with that. Otherwise, a lot of the kids, we actually do see these. Most of the times we can do something for them. Sometimes it is that we do things in stages. Like you come in and it's like a polytrauma, and a polytrauma is essentially you've got multiple injuries all over your body, and we will see to you in stages. Like, so if you have a broken leg, we will fix it, but then it might not be in like one sitting. So we will essentially put some screws in externally, and then as time goes by, if you need a skin graft, we will take skin and then apply to the area if it was open or in that matter. So then it like happens in stages. The other pros of being in theatres, it's that you get to help them. Like, I'm gonna explain something. I was watching a series recently, and then they were discussing, they showed a scan, and in the scan the liver was like in the chest. We know it's supposed to be
and the ears.
So the covering, which is called your diaphragm, it was open. So it is called a diaphragmatic hernia. So I look at this and I can identify it, and I'm like, oh wow, I actually do this. Like I actually assist with these surgeries, and then the child recovered so beautifully. And I'm just like, but but that's what I do.
Yeah.
And I'm like, I'm watching this and I grew, and like you grow to love certain things because you just realize the impact that you as a scrub sister and the surgeon has in that child's life. And like, I'm fascinated and I'm amazed by it because I'm like, we really make a difference in those children's lives. We also do see to kids who are not ill. So like, you'll get kids who either have like an extra finger, it's called like we then will remove the extra digit, or they just have like an extra like
skin
tag and we'll remove it. So they, or like dental removals, like we remove their teeth. So sometimes it is that the kids are not really sick, we just say to them because it essentially it helps them, or for cosmetics purposes, we just make them look a little bit better. The cons of it though, it can be very taxing on your personal health. Like for me, I've experienced it myself. Because I haven't. Okay, let me say this. I scrub for very long surgeries. Somehow it is me. I'm that person. But I also do prefer it. But if you don't eat well in the morning and you neglect yourself, then it does affect you in the long run, because if you're scrubbing like for like say 3 cases in a week, that's like 6 to 10 hours, you do end up feeling it. So it's like something, it's a place where you need to look after yourself, because otherwise you won't be able to help your patient. Other cons are that you cannot work if there is no team.
True.
So sometimes we'll have to cancel patients because there is just no team available, or someone's sick, we need to call somebody. That I think is a con in theatre. I think other cons is where you have unexpected deaths, where it's like they came in well and we do the operation and there's a death on the table. Right? It was so unexpected. So emotionally we become affected. Or sometimes there's underlying issues that maybe the child didn't have a full workup, or it hasn't been discussed, and that there's a death on the table as well. That really, it takes a toll on you.
I can imagine.
Yeah, like for instance, I had a colleague and she literally we were studying at the time and she wanted to quit the studies, and I was like, girl, you can't do this. Unfortunately, the patient passed on. It wasn't your fault. Yes, you are in the theatre and you are responsible, because like I said earlier on, you need to advocate for your patient.
Yeah.
But it was just one of those things. There were underlying issues and the child just couldn't recover.
Sure.
So sometimes we do experience that, and it's heartbreaking. We step out of theatre and we will release our emotions. We would cry, we would be hugging one another. And I think another pro is that in my department, that if there is something in the event where there's a death on the table, we are very affectionate towards one another. So you always have that support. Like we will go to that person, we would stand with that person, whether it's just hold their hand. Even if we say nothing, we just hug that person, because you would know what it's like to experience that. So we always just there for one another. Yeah.
Sure.
There's a lot more that I can add, but
yeah, what I was gonna say.
I think we will leave it there. I can speak for, like I can go on speaking about the pros and the cons, and yeah, the only thing is like the long hours.
Yeah.
So you will be standing on your feet for long hours. If you're not, people do get dizzy if they're not wearing like their stockings that promotes blood circulation within your legs. People do get dizzy. Obviously, when you are pregnant, you are prohibited from scrubbing for certain surgeries, because we are exposed to radiation in certain surgeries, so then it's not advisable for people to go in there. So, like if you work in cath lab, we have a cath lab within our department as well. Obviously, they would not be sending anyone there, so you need to be aware of where you want to be allocated. So whether it's in theatre or in cath lab, but you also then need to speak up for yourself and also be aware of yourself, so that you can tell them, look, I cannot go in there because of this reason, that reason, and that reason. So stand up for yourself, because sometimes when you advocate for yourself, you are also advocating for your patients.
True. Very true. Very, very true. So what's the, not final thoughts, but for people who want to do theatre, to be a theatre sister, what is your advice to them?
My advice would be that if you are okay with standing for very long,
then
you are most welcome to come join theatre. like I said, it is very, very rewarding. Sometimes I'll be standing for 6 hours and I don't even realize, because sometimes the surgery itself is so intriguing, or you can see they are struggling and you can assist them and you're innovative. Like, I watch a lot of medical series, and not that it always helps you, but you sometimes identify certain things. And like, I also do read a lot, so then I'll read up on anatomy or whatever it is, and then you'll just find out more. And in that, when you improve yourself in like your area, or advance your knowledge, advance yourself within your area, then you are able to essentially advise your surgeons. Like, I see you are struggling a bit, you can
try this,
you can try this or try that. And I think that the fact that we are so versatile at Red Cross, we are able to help surgeons when they are struggling, because then you would have been exposed to something somewhere else and you'll be like, you can use, would you like to try this? You don't obviously tell them, use this. You can advise or ask them, would you like to try this?
Yeah.
And sometimes you make a good impression, and you have great impact, because you know your surgeon capabilities, you know your own capabilities, and you can work well as a team. Why I would advise people to do theatre nursing is that there are very few of us who actually do love it. And I think being in theatre, it requires a specific type of person.
Yeah.
Like I said, who's either able to stand for long hours, can work under the pressure. Because there are people who came and left because they just can't deal with the pressure.
Yeah.
Because yes, you do work in a team, and you must remember that you cannot work. It's team dynamic. So if you cannot work in a team, then
you can't work. No.
Yeah,
it's
then
not for
it
you.
won't suit you.
Yeah.
Because you can, because if you have a very like a passive aggressive or hostile personality, or like abrupt, then you probably won't
do well
in theatre, because you will have that person who you're going to need to be kind with or humble with, because at some point you're going to need to ask, can you help me with this, can you assist me with that?
Yeah.
And sometimes your hands are tied because you are sterile and you cannot touch something else that's unsterile.
True.
So you really need to be in like, you need that mindset where I need to work with the team. And sometimes you're not going to always find a great nurse, or somebody that is, let me not say a great nurse, somebody that doesn't have as much expertise, and then you might be new to that specific procedure. So you will always need somebody. So you should always have that mindset of, I'm going to need somebody, and that person's going to help me.
True.
And sometimes even if both of you don't know, it's always
It's okay.
advisable
Yeah.
to ask assistance from someone else, and
Yeah.
there will always be a help. But other than that, like, theatre nursing will allow you to travel, in terms of you can attend congresses if you would like to. You can go abroad as well, and then do much more work at like a larger scale, or like at a first level in a first level country. You can be exposed to a lot more compared to I'm not saying South Africa's healthcare system, or at Red Cross specifically, is awful, because I think we do great work. We've got great equipment that a lot of other hospitals that I've also been at, I have not seen. Or when I see doctors come in, they're like, we don't even have this in our country. So I know we are very fortunate, and having the resources within Cape Town, I think, helps you as a theatre to be, or as a theatre assistant, to just deliver more adequate care to your patients.
Sure. I love that. Thank you, Lydia. Thank you so much. And what is your last parting thought?
My last parting thought, I would say that work well, have a great work ethic, be kind, and love what you do, and you will succeed. As a theatre nurse, the hours are going to be there, the challenges are going to be there, but always remain positive. Like, I think the one thing for us at work, we tend to turn to humor. It really helps us, because our work can be very taxing. So like, we will make fun essentially about a lot of things when we reach the tea room.
Yeah.
We will we will ask advice, and that's the thing, like the group dynamic is something that you will become accustomed to. So that for me is like an important aspect, is that it's a group dynamic and to just be there with one another. Because often, I mean, in theatre we work long hours. So we are required to work at least 40 hours per week, but most of the times we are there way longer. And having the team dynamic where everyone's supportive and there for each other, it does help. And like you see your friend and you can laugh because you know she's going to do something funny. So it's not like coming into an environment and everyone's just for themselves. So I enjoy it because of the dynamic and the expertise that there is, and how the fact that we get to learn every day. Like we get to learn something new literally every day. There's not a day I can say like, okay, I learned nothing today. So it's a place where you can literally learn every day. Like for instance, even if we do certain surgeries, you will find that, but the anatomy is so abnormal, or like it's this, it's like literally in a different position, or there's something extra, or like you discover new things every day. And like sometimes you're operating and they're busy and media is in one theatre because they were doing something so profound, yet in another theatre you're doing something, but it's like the first time we're ever doing it, like in the country, and they're not even aware of it. So like there's literally things that like keeps you on your toes, and you get to do research, and it's just so fascinating being in theatre. And the other thing that I must mention is you must be able to tolerate blood. The sight of blood means if you can't,
you're gonna faint.
We will find you on the floor.
Parting thoughts. Okay. No, but thank you so much for such a well-rounded, beautiful description and explanation of what a theatre sister does, you know. And just also clarification, this is not just for children. You can also be a theatre sister with adults, right? Yeah. And it's similar, right?
Oh, the other thing that I forgot to mention is that you get the theatre nurses not just like with kids, they are adults. And then you can work at like a day clinic as well. But that's like more private based. So you get private hospitals as well, but then the private day clinics where you do get the day clinics in government as well, where you come in on the day and you get discharged on the same day. So there is a variety of aspects. So if you do feel you don't want to work long hours, then you can do a day clinic as well. Yeah,
because it's not as long.
Yeah.
But thank you so much for coming on this episode of being on the Dr. Tebz Show today.
You're welcome.
Thank you. And thank you viewers for watching this episode. And if you'd like more information about this, please do leave your comments below and we will respond. And please don't forget to like, share, subscribe and push the notification button so you'll know when we post our next episode. So until next time, please do take care of yourselves, take care of each other, and remember, your health is in your hands. God bless.